exactly. Thank you.
Call the meeting to order if you want.
Yes, I would like to call the meeting to order at 9 o'clock. As Jim said, we have a quorum. The first item on the administrative list of this agenda is to approve the minutes of September 8th, which you have received. I hope you've looked at.
Yep.
Are there any comments on them? If not, I would entertain a motion to approve
So
I'll make-
moved.
Okay.
by somebody. Okay, who moved it?
Ellie?
Okay. And
Seconded.
I'm
Romy.
not sure. So I
Pardon?
think that,
So,
have
so
I
wait,
been appointed yet?
so
maybe not.
you're Dr. Westpizer's backup. So pull
Okay.
that second back, please.
Okay, so there is no second yet at the moment. Diane is seconding.
Yep.
Okay, so we have a motion and a second to approve the minutes of September 8th. Is there any discussion? In theory, we have to do a roll call vote. Am I correct?
Yes, I can help facilitate that.
That'd be great. Thank you, Jim.
Jim Stockbridge, yes.
Pat?
Diane,
Yes.
Please go ahead.
Brandy,
Yes.
Pat,
Yes,
Jane,
Yes.
Dr. Westpizer,
Yes.
Rebecca,
What are we voting on?
approving the
Minutes.
minutes of September 8th.
I vote yes.
Tom.
Yes.
And Jordan from New Marlboro.
Yes.
Great. Thank you.
Okay, great, thank you. The next item is one that is exciting to me. Leadership election. We need a new president and a new vice president. I am clearly, not clearly, but I wish to state I don't wish to run, so don't even think about it, and I hope nobody was anyway. We need a nomination for president and a nomination for vice president. I'm unclear when they take over, Jim.
Yeah, so let me give you a quick where we're kind of like where we're at. And I want to thank Pat and Rebecca for coming out of the gate being chair and vice chair when the collaborative started. We really appreciate everything that you've done. And, you know, one of the things we're still working on through the articles of operation is trying to, at some point, probably in January, we may want to have some term limits and, consecutive terms and whatnot. Because I think the goal overall is to rotate people so people get experience, they get empowered, and we just continue to rotate out. I did have a couple, and that would, Madam Chair, this would take place in January. Well, we would come right out of that. I don't know who's got a lot of background noise, but the goal is to start fresh in January, so it's just clear, and then the governing board can figure out the term limits, once we wrap up the articles of operation. I did have a couple people, that are interested, and I know of. I mean, I don't know if I should start the nomination, but we can, whoever wants to nominate whoever, we can figure that out. But I want to nominate as the Stockbridge rep, Diane Romeo, to be the new chair, assuming there's a second and an approval for that.
I would second that, or either Brandy or Pat. So we have a motion and a second for Diane, unless there is, Diane, I assume you're accepting this nomination?
Yes.
All right.
Who says no?
Okay. Is there any discussion? If not, I would take a vote. Jim, do you want to do that again?
Sure. Make a motion to nominate Diane.
Oh, no, I thought you did. Sorry.
Well, yeah. So a roll call vote.
Right.
Jim, yes. Diane, you vote.
I'll
for yourself.
abstain. Yeah.
Brandy,
Yes.
Pat,
Yes.
Jane,
Yes.
Dr. Westpizer,
Yes.
Rebecca,
Yes.
Tom. He's on mute.
Yes.
Thank you, Tom. And Jordan.
Yes.
Thank you. Welcome to the club.
Right. And we also need to nominate and elect a vice chair. Are there nominations for that? Diane?
Could I suggest Brandy Page as the vice chair?
You certainly may. Is that a nomination?
Yes, please.
Okay. Are there any other nominations? Is there a second to that nomination?
Second,
Okay, who was that?
Terry Gould.
Okay, thank you. Moved and seconded, Brandy Page as the vice chair, starting in January. All those, well, we have to do a roll call.
Yeah, Jim, yes. Diane,
Yes.
Brandy, you can vote for yourself if you want.
I'll abstain.
Pat,
Yes,
Jane,
Yes.
Dr. Westpizer,
Yes.
Rebecca,
Yes.
Tom,
Yes.
and Jordan.
Yes.
Thank you so much, everybody. I do want to, maybe we should do some introductions because we do have a couple people that come to meetings and some that don't. We have a large group here. So I wanted to make sure everyone knows who Dr. Westpizer is, Dr. Mency, and everybody else. So if we could just do a quick, and Jason's been on board as the collaborative inspector. So if everyone could just do a quick introduction real quick, everybody will kind of know who everybody is.
I'm not sure how to do that because we're all in a different array on the screens.
Yeah, I could. Ellie, go ahead. If you can unmute. All right. Well, Diane.
Lennox Board of Health.
Joy,
She back?
sorry, I finally
Sorry.
muted, sorry. Ellie Lovejoy, and I guess I'm Dr. Westpizer's backup.
And Ellie's working for Tri-Town now, part-time. Thank you.
Oh, okay.
Oh, yeah, sorry. Yeah. Thank you.
Hello, everyone. I'm Jason Dragonetti. I'm just going to jump in and introduce myself. I've been working with Jane and the collaborative. Most everyone here has met me or knows me. So nice to see you all.
Pat Levine, Sheffield, Board of Health.
Hi, Bob Westpizer, Lee Board of Health. For many years, I'm a retired primary care doc in the area.
Welcome.
Welcome.
My
My name is Jane Smith. I'm the Southern Berkshire Public Health Collaborative Shared Services Manager, and super excited to have Jason on. In case there's any question. Jordan?
Jordan Creation, New Marlboro, Board of Health.
I'm Brandy Page, Town Administrator of Otis.
And I'm Terry Gould on the Select Board in Otis.
I'm Rebecca Jerzyk. I'm the health agent for the town of Great Barrington.
Dr. Blagg? I'll try to unmute you. Well, as he works on that, Dr. Blagg is Lennox Board of Health. I think you're fully retired physician.
Yeah.
Okay.
Jill Sweet, the public health nurse for the collaborative.
Tom?
I represent the Board of Health in Monterey. Myself and another member, Mort Sullivan, have been attempting to participate in your monthly meetings to get a handle on what's going on. It's a pleasure to be with you all.
And
Neil?
is that everybody? Yeah, cool. Well, thank you, because I know there's some familiar faces and some newer faces and stuff. But all right, I think we're all set, Madam Chair,
Thank
to
you.
move to the next agenda item, I think.
Okay, the next agenda item is meeting frequency. We've been meeting sort of monthly, I guess, or quarterly, but we've talked about meeting quarterly. And now that I think things are much more settled and not as much decision-making called for, quarterly may be fine. I'll open the floor for discussion on that.
Yeah, and I think we talked about this a couple meetings ago, Pat. You know, the intermunicipal agreement that's active requires that we meet at least minimum quarterly. It's called out in our articles that have yet to be approved and whatnot. And, you know, the last couple of years have been super busy coming out of the gate, getting the IMA signed, you know, filling positions, work plans, a lot of decision making has gone into this. And, you know, we have been meeting monthly or the last couple of months every other due to vaccine clinics with staff working many hours. And I think what we talked about the last meeting was maybe move to a more quarterly way of going, you know, to keep things fresh because everyone values their time. And then the staff could meet with the chair and vice chair kind of monthly if anything pertinent comes up, albeit no decisions for the collaborative will ever be made without an actual meeting. And I think there was kind of agreement to that. You know, something interesting comes up or time sensitive, we all could call a meeting, you know, with respect to the open meeting law and all that stuff. Something, you know, earth shattering comes up, there's a grant opportunity that has a deadline, we can always set up a collaborative meeting. We still hold that authority to do that outside of the quarterly. So I think that's where the thought was to, you know, maybe get more participation because people are kind of competing with each other on meetings and this and that. And I think, you know, the biggest next piece is what Jane will talk about soon is filling the next position. But, you know, Jason's settling really well. The IMA's in good shape. Vaccine program's kind of, and it's running itself with Jill and Jane at the helm. And I think we're in really good shape. Well, I mean, it's functioning the way it's supposed to be functioning without, you know, us sitting down every month to kind of go through all that.
Good. Thank you for that background and memory refreshing on the last meeting's discussion of the topic. Are there any other comments about it? Any concerns about moving to a quarterly meeting?
I have a comment of more than a concern is, you know, the other thing that I would like to talk to you guys about is now that we have Jason on board, it frees up some capacity to do some like trainings. And I'd like to do at least, I'd like to like look at maybe doing 4 trainings a year, maybe a septic training, maybe we do one on nonprofit food or temporary food services, that sort of thing. And so when we are talking about this, I'd just like to keep in mind, like, whether or not the group thinks that they would want to do that as part of the meeting and have it be a longer meeting, or have that just be available in between meetings. So I just wanted to throw that in there.
Jane, how long do you think these trainings would take?
I mean, I think it depends, but maybe if we were very specific to a topic, which I think is really helpful, maybe we could keep them at just an hour.
Okay.
Yeah, I think that extends the I think it detracts from, I mean, I think the business and the training are 2 equally important things, and to have them together, first of all, it sounds like it would make for a very long meeting. Secondly, I think it one detracts from the other, and you may not want the training. You may be fully competent or comfortable with the topic, and then you'd end up being there anyway. I think calling that as a separate meeting, my personal opinion is calling it as a separate meeting between the board meetings would be ideal.
Okay.
Well, one thought, Jane, you know, we do have the
and we could do that, or we could also have the board meetings and then have an optional meeting afterwards. But yeah, that's not, that is not to say this is a separate issue of it's appropriate to have quarterly meeting.
one thought I had is we do have technology to record trainings and make them available. The only downside of that is you lose that back and forth question and answer session. But we could talk about that internally about creating some topics, and we can kind of beef those trainings up to a point where we could record them and make them available on like YouTube or something like that. Because we understand that it's difficult, and if we break our meetings up into quarterly, then we may have a jam-packed agenda as well, since we're now meeting quarterly, then a training on top of that. But I think we can. I think the goal of what Jane's trying to accomplish is to provide resources and tools and trainings to board members.
Well, and might it not also be relevant to boards of health members who don't come to these meetings, but would be benefited by attending a training session? I know my board, some of my board members certainly would.
That's a really good point, Pat. So what I'm hearing is maybe we'll just keep it separate, and we'll try one training and then check in with you guys at a quarterly meeting to see how it went, and we'll just play it by ear. Thank you for considering that.
Thanks, Jane. So we are on the topic of the frequency of meetings. I think to close this out, we need a motion to schedule our meetings on a quarterly basis starting in January.
I'll make that motion.
Thank you, Brandy. I'll second the motion. Is there any further discussion? Roll call vote.
Jim, yes. Diane,
Yes.
Brandy,
Yes.
Pat,
Yes.
Jane,
Yes.
Dr. Westpizer,
Yes.
Rebecca.
Yes.
Hi, Mike, Tom,
Yes.
and Jordan.
Yes.
All right. Thank you.
Great, thank you. Under old business, we have articles of operation. We have seen these a couple of times. We've had an opportunity to make comments on them. Are we at the point, Jim, of wanting approval, or we have another round?
Yes, Pat, if we could just go back to number 2, the public health nursing update.
Oh, and that's the one that I insisted we put early in the agenda so we could cover it months ago, and now I've skipped over it. I apologize.
That's okay. It's all good. The quarterly report is not done. We had a very busy clinic season, and then the day after we ended, I had surgery. So I'm going to work on that next week. Did have a car seat event September 9th at Lee Bank. Fire and police, EMS, state police are there. We use our interpretive services for Spanish speaking. We could have had 3 more people, translators there. It was well attended. I think I had 11 families signed up. We end up with like 23 cars roll through. Lee Bank graciously donated 5 or 6 car seats. Those were all given out. I gave out the majority. I think I gave out almost all of my car seats at that event. Mandy Summer, who was my instructor, she donated, I think 6 convertible car seats. So I do have some. I was just quickly scrolling through my email from the last month, and I have lots of requests for car seats. So hopefully I have enough to go around. And I don't know the numbers for the flu clinics. We did go through the 450 doses of high dose. I think we have like 50 something of the regular dose of flu left. So if you know of anybody that needs a flu shot, have them get a hold of us. And what am I missing, Jane? I don't even know. I've been off for a month. I don't even know. My brain's turned off right now.
But you're well, you're okay.
I am great. Yes, better than I was a month ago.
Terrific.
Yeah.
Can I just pipe in with a real quick compliment? I just want to tell you, I go to all of these, not all of them, but many of these meetings with lots of groups. And what you guys did with your flu and just your immunization clinics are just spectacular and catching some notice. I'm making sure that DPH, when we talk about these groups and stuff, that they know that you guys and Jane, I don't know how you could even keep your eyes open to drive at this point. You guys have done some great work out there.
Thank you. Actually, this clinic season was fabulous. We got a lot of feedback from people just how nice it was. Like it felt like we were caring for our people, and that makes it very much worth it. Even with all the glitches here and there that undoubtedly happen with a program like this, when you sit down and have someone really thankful to be cared for in their own community, it makes it all worthwhile. And we do have breakdowns of the town similar to last year. You know, I thought about just handing it out, but the other thing that I'm wondering is it might be nice for, now that Jason's on, it will free me up to go to the different Board of Health and maybe present, you know, kind of how things have gone and make that connection, just to make sure that the boards know that we're here and, you know, that we are anxious to just serve them in the way that they want to be served. So thank you.
Nice.
Mike, one thing that we did before you came on was introduce ourselves. There are some new members, some new faces here. Maybe you could do that for a moment.
Thanks, Pat. Yes, I'm Mike Hugo, and I am the Director of Strategies and Government Affairs for the Mass Association of Health Boards, and we are your organization to bring your issues to DPH and to the state legislature, and to supply not free legal advice, but free legal education to all of the boards. And also we do trainings. We do Board of Health member trainings that end up having more staff than Board of Health members sometimes, but we will be scheduling one out at the Delaney House. That'll be the closest one to you, and that'll probably be in March. We don't want to have snowstorms, but for those who don't know MAHB, we are the really the organization for boards of health, and you all belong, whether you know it or not, because Jim and Jane have paid out of the grant funds for all members. So you do belong. We have online, one of our best resources is an online legal guide. And if you need to get into it and you can't figure out how, we can just I'll put my information in the chat, but reach out, and it's 160 pages long, and it's very fresh. I just rewrote it last year. And so it's got lots and lots of current stuff in it, and it'll get you through hearings. It'll get you through open meeting questions, all of that. But we're here for you. And I've been working very closely with Jim and Jane since the beginning, I think. And I try to at least drop into every single one of your meetings. And I'm going to have to be off at 9:45. I have a hard stop at 9:45. So if anybody needs anything, let me know that.
Thank you, Mike. I appreciate all that you've done for us. It's been an excellent relationship.
Thank you.
Madam Chair, if I could just add briefly about the clinics. One of the things that I see and feel, there's a lot of bodies that go into preparing these flu clinics, not just Jill, and we have a bunch of per diem nurses that we have. Jason, when he converted over, has been helping Jane. One of the things that I'm really cognizant about is Jill and Jane's time during, even though it's a short season, there's a lot of functionality that goes into these clinics. If you've ever been to a clinic, it's fascinating how many people volunteer in the flow, and people are drawing and what, all that kind of stuff. We're always looking for volunteers. And I know, and I can't speak for Jill or Jane, I know the MRC kind of helps out here or there, but it's one of those things where we're going to really look hard in the off season of figuring out a way to better be efficient with our clinics, because it's a lot of clinics in a very short period of time. But we're really always looking for volunteers, and I want to make sure that Jill and Jane have enough staff when they run these clinics, because it's a lot of work. It's a lot of preparation. It's a lot of time. Jill and Jane kind of roll up their sleeves probably like in May or June, and they start planning for the following season. So it's like a 6 to 8 month process, although the actual clinics are short. And I'm just fascinated the amount of time and energy that goes into these clinics and how well they run. And we're always collecting feedback on how to make things better. And I'm so glad that we have this nice, sustainable vaccine program. It can be better because we could also use help from the state, Mike, on this vaccine equity issue, especially when we're on the hook of purchasing all our COVID vaccines, which is super expensive, by the way. We could have got more, but we're almost $100,000 into vaccine purchase just this season alone. Because if the board remembers, last year we got all the COVID vaccines for free. Now we're on the hook, and the demand is still there. If we could have probably bought more and probably administered them, but we have to be cognizant of our funding as well.
Jim, can I ask a point of clarification? When we had those free free doses, we were still able to claim the insurance
Yes.
refund?
Yeah.
Okay,
Yeah.
so we're ahead of the game in that regard.
Yes.
Secondly,
Yeah.
I don't remember hearing any call for volunteers this year. Last year, I helped at a couple of clinics, and I kept waiting to hear that I might be needed again. And I don't know how you, so that maybe you didn't want me. That's okay. But I
No,
don't
that is
recall-
not the case. Well, and so we used MRC, and that's part of what we need to go through. The MRC volunteers are, doing other clinics, and last year because we were a new program, we were using non-MRC and MRC volunteers, because then the volunteer management piece, like part of it at least, was taken care of by MRC.
He mentioned
I really feel like maybe MRC cannot be the only place that we should ask for volunteers. So I think it's a really good idea, and we'll put that on our flow for next year, to reach out to the Board of Health members, especially in their own towns. I mean, I think it would be very impactful for Board of Health members to be able to help us with this, and it would certainly help us as well.
Yeah, and to be seen with your community as helping, I think is also good. Okay, thank you. Thank you, Jill. Glad to have you back in such good form. Now we'll move on to old business, unless you had anything else. No, okay. Articles of operation. Where are we with that, Jim?
I think we're still in draft form. I think what I recall, there was a lot of changes at one of our meetings. We made a lot of those changes, and I know Rich Mucci, Mike, offered, his feedback, but we never heard back from him. It was one of those things where, like, I think in one of the emails, he was wondering why about the redundancy, because with the IMA, we kind of clarified that, but we never really heard back from them. And, this governing board has been working on these articles of operations. It's sort of like the cliff notes of the IMA, how we function. It doesn't contradict the IMA because we can't legally change any functionality of the IMA without the 12 towns in agreement. But the articles of operation is more of a localized governing board document.
I'm familiar with it.
And I think there's no conflicts in there at all with respect to the IMA. And I think probably, Pat, in January, we should put that on. We should move that up into our agenda and kind of just wrap that up. And I think there was consensus about giving that to the towns as an addendum once we renew the IMA, so they can see the functionality of the governing board as well. So that's kind of like where we're at.
Yeah,
Jim, why don't we pick up on that the week after Thanksgiving? I will set up a time, and you and I and we'll get Rich on a Zoom, and we'll finalize whatever his concerns were. He was concerned about any kind of conflict between the articles of operation and your IMA, and that's what he was looking at. When I don't know what happened to him. I talk to him all the time, and this just seems to have fallen off of both of our radars, and I apologize for that. But let's pick it up the week after Thanksgiving, and we'll get it.
Perfect.
Right, and then if you can get it out to the members of the board so that we can look at it and be sure that we're ready to vote on it in January.
Yeah.
Great.
So, and what I had sent in the actual agenda packet was the most updated with without all of the crossouts and whatnot. So last month, if you'll remember, we had crossouts, we had a couple of questions that were talked about at the meeting. So what you have this time is a cleaned up copy of what we've already kind of agreed on at previous meetings. And so what we talked to with Rich and MAHB probably won't differ that much from what was included in our agenda packet this time.
Okay. I mean, if that's the case, just send that version out. I mean, whatever is the absolute latest version that we need to vote on would be terrific. So we'll put that on the agenda for January. Next item is language support for local board of health or for boards, I guess. Jane, I assume that's yours, or Jason?
Yes. Well, so at the last meeting there was some interest about having every board member that was part of the collaborative have access to language services. And so what I thought would work is if each board of health could just designate someone in their organization, you know, that could have a PIN, or I need a name to give them, and then to give ITI, then ITI will give a PIN, and that PIN can essentially act as the PIN for the entire board of health, for instance. Some areas where this might be helpful, especially on housing inspections as well as food inspections, they have over 200 languages. And so I feel like this could be a really great thing for towns. So really all I need from the towns is to figure out who I should put in as the name. Should it be the representative from the collaborative? Would that be just the way to simplify the process? And then
You're breaking up.
And I'll jump in. She's breaking up. So for those that don't know, we have a contract with an interpreter services group that will actually come out or provide 24/7 services over the phone for over 200 languages. It's something that it's a need in our community. You know, we've reached out to VIM and Multicultural Bridge and these other organizations, but sometimes it's a burden on their staff and capacity to help us out. We even, over the years, you know, BHS had interpreter services as well. But when someone needs something quick, like on a housing issue, like we had a Turkish homeless family walk into Tri-Town one day in real time, and we're like, how do we help people out? So this is sort of, and so this is a collaborative thing. So get whoever wants access and wants their own PIN. You know, Rebecca, you need interpreter services. Obviously, we have to pay by the minute, so just it's one of those things just to be mindful with when it comes to cost. But it's meant to. She got kicked out. It's meant to support the collaborative,
But so the inspectors, even though if they're working in Sheffield, for instance, they would use a PIN that they already have. Yes. I don't need to supply them with one for any inspection.
No. But what Jane's saying, Pat, if you and your board wants a PIN in case you need the services, right, give her whoever the contact is, and she'll get you that PIN.
Right. Okay.
I mean, even sometimes when we're in the office, I remember when I was in Great Barrington, I had a person come in that was Spanish speaking and trying to set up a business. And it was very frustrating not to be able to have that ability to communicate with them. It was frustrating for both of us.
Right. Great. Okay. Thank you very much for that. Anything else on that topic? Please give Jane the name of anyone you wish to have access to the service, and she'll get a PIN for that person. New business, clinics, Du Bois, Saturday coming up.
Yes, so We ended up purchasing 500 doses of the COVID vaccine, and it did not meet the needs of the community. Also, about half of our clinics didn't have COVID, was not available when those were offered, either because it hadn't come out yet or because we were waiting for delayed shipments. So similar to last year, we're going to do one Saturday clinic kind of at the end. Because we don't have the funds to purchase our own vaccine, we are using a state program that brings in an outside vendor to come in and do a mobile clinic. And so, you know, we're grateful that that exists to meet the needs of the community. And I'm sure there'll be follow-up discussion with the state on, we're hoping that we'll have the capacity next year, because we'll have additional vaccine revenue coming in. And then we, of course, have the contracts with the towns, which can help pay for the vaccine. So it's kind of a one-time thing. We're expecting about 200 people. And, you know, a lot of people have said that they were kind of holding off on getting their vaccines and now are ready for the holiday season. So you'll see advertisements. We pulled an advertisement in the Shopper's Guide. I have a radio. Going to talk on the radio, I think, on Tuesday of next week, and just encourage you to help us get out the word about this clinic, just kind of as a wrap-up clinic. And the reason for the Saturday is a lot of people work, right? And also it's more convenient for a lot of families that have sports and whatnot. So we're glad to be able to offer this to the community.
Great. Thanks, Jane. Any questions on that? Okay. Equity Access Coordinator / Community Health Worker position. Whose topic is that?
You want me to take that, Jane?
Yeah, go ahead.
So sure, yeah. So as part of our public health excellence funding and our expanded dollars that we're getting on an annual year, we've budgeted for a half-time equity access coordinator, hence community health worker, although DPH doesn't want to use the term CHW. So equity access coordinator. So PHE is funding it half-time. We believe it should be full-time with benefits, because I think we're going to be struggling trying to find part-time positions. So Jane and I are we're finalizing the job description for that. Hopefully someone with bilingual skills. We're hoping to post that position post Thanksgiving weekend. We could send out the job description to everyone if they have ideas and feedback. You know, obviously it's in a specific format, like all our job descriptions are, but we're hoping to advertise, start interviewing, and have this position in place in January. And this position will have a lot of functions. It'll support Jane administratively. It'll support Jason, start working on closing the gaps on equity, help with flu clinics, help Jill with homebound vaccination programs, and so much more. You know, getting out in the community to really help with equity, public health, all the functions of a community health worker. And I think it's sorely needed, and DPH has supported that position. So we're a little bit delayed. You know, we kind of got Jason on board mid to late September, and we're sort of flu clinic season kind of took precedent, but we're wrapping up that job description. I'm really pumped about having an equity access coordinator. Tri-Town had several CHWs years ago through the Prevention Wellness Trust Fund. We were doing fall prevention programs and Tai Chi and healthy food options and helping people, helping up the senior centers kind of add on to the blood pressure clinic. So there's a lot of opportunity to be had with this position, and I'm really excited that we're almost there.
Could you share that job description with the board? I think it would be useful for us to understand a little bit some of the details, and if we have suggestions, certainly I know you'd be open to them in a prompt manner. Great. Any questions on that? Any discussion? Okay. Alternate posting for the collaborative. What does that mean?
Well, it came, I think, Mike, you and we talked about this at a recent meeting. So the town of Lee is our legal posting for Tri-Town.
Oh, sure.
So we,
Okay.
so we meet all those legal requirements. And then
Yeah.
Jane sends the posting out to every single clerk, which also gets posted in their town hall.
Right. Let me, because I'm gonna have, I only have 5 minutes left before I have to get off. But okay, so that what Jim just said creates pandemonium, because then everybody has this obligation to post. So we've been working with the AG's office, and we found that there's actually a nice little a fix for that.
Loophole.
So yes, there is a loophole that we were able to convince them applies to you guys and to all of the other groups. And that is that we will send you a text that we've written that is a motion to adopt blah, 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 CMR, whatever number it is, which allows for collaborative groups and regional efforts to post in one location. So each of the boards of health will pass that motion, and then each of the towns will post on their webpage, wherever it is that you post your agendas for your minutes, for your meetings. I'm sorry, you'll post a notice that you belong to the South Berkshire, whatever, and that that you meet occasionally. And I guess now you'll be able to say at least quarterly, because I know this group, you're never going to meet only quarterly, that for further detail, please see, and then they'll either be able to click it right there, or it'll at least say town of whoever the host is webpage, and only that one place will have to post it from then on. So you are subject to the open meeting law, and there's no question about that. We've been back and forth with the AG trying to convince them that you're not, but all of these groups are. And we don't want to see anybody get in any trouble. So we will help get done.
Is there any, what happens if a town wants to post it anyway?
Oh, absolutely. Absolutely can. Totally can. And in some towns, it's actually, I think, a good idea politically to show that your Board of Health is busy and doing stuff, which when you were talking about the clinics, I think certainly whoever's up for election that year might want to show up at the clinic and help out, signing people in so they get to talk to everybody at the door. So I'm always thinking politically. That's half of my job, political director. So
Thank you. All right.
Okay.
So we appreciate the work that you've done in the background there, and we'll look at that motion once it comes. And each Board of Health will need, each member Board of Health will need to pass that. Okay.
Yep.
Great. All right. Quarterly training topics is the next item. Jane?
So this kind of backfills what I was talking about earlier. I'd like to start doing trainings, and we don't need an exhaustive list right now, but I think it would be good to hear from you guys about things that you might be interested in. Topics that come to mind in my mind are dealing with temporary food and nonprofit. I have a guide that I've been working on for years that I just need to work with Jason maybe to tighten up, making sure that it applies to the new food code. That will be like a chart and make it really easy for people to navigate, and boards of health to navigate when permits are needed, when ServSafe is needed according to the food code, that sort of thing. And then, we've had some issues with septic systems, and maybe just do a refresher on like some tools that are available to help review septic system designs and what that process might look like for towns that are struggling with understanding what the Board of Health role is, not just the person who's doing the work, but the other members as well, because it is a big responsibility. So I just wanted to know real quick if there were other topics that you guys were interested in, or whether those are topics that are relevant to you as members. So just putting my listening ears on.
Thank you. Are there any ideas that you have right off the top of your head of training that would be helpful? One can always send them on to Jane at a future time, but if there's something you're thinking of.
No, but I really like that food one. I'll be anxious to have her get that completed.
Great. Anyone else?
Well, one of the things I'll add, because some towns in this collaborative aren't part of the tobacco control program,
Thank you.
Sheffield, Sandusfield, and New Marlboro aren't part of, it used to be at one point or another, and something that came up the other day at the statewide meeting at PHE is a lot of PHE towns want to be part of tobacco control, but tobacco is under a state contract that can't be reopened. And so we're going to end up training Jason up quite a bit, who has a lot of background already working at Tri-Town for many years on tobacco. And I'm probably going to do some type of training for those towns or just in general, probably in January, February, on what the tobacco program is, how we can support Sheffield and those other unfunded towns until we can get you in tobacco control. And so that's one topic I'm working on right now. And so, although these 3 towns aren't part of tobacco control, I'm still here to support you, Pat and Jordan and others, if you have questions and to help support you. We can't do compliance checks because that's funded by the state, but what we're going to offer some type of tobacco training probably in the new year for that.
Great. I've already noted to put you on the agenda for the Board of Health and its January or February meeting. Terrific. Other ideas for Jane?
I just have a comment, really. All of those training ideas sound great. I would love more training on tobacco and septic and food. But we do have 2 training hubs in Western Mass. We have the FERCOG, and then the Alliance is, I think, a training hub. So my only comment would be to, before we plan and prepare a training, is to look at what both of those training hubs have offered to make sure that we're not offering the same type of training.
Good comment. Thank you, Rebecca.
Yeah, I think it's a great idea. I know Jane and we've met with them a couple times, and they're still trying to figure out staffing. There's a lot of training hubs across the state, and so we're really interested to see what experience they have and what staffing they have to offer that for multiple counties. Tobacco control, that won't be under the training hub. The training hub is really how to do housing inspections, septic inspections, food inspections, so on and so forth. Tobacco control is its own separate entity, and they won't be providing any training on tobacco control at all. So that's the role of our program. We get funding to provide technical assistance on tobacco control. We cover the majority of the county, but I know Jane and I have a meeting that we're trying to sort with them to start figuring out what they're going to be providing. And I think all the training hubs, Jane, correct me if I'm wrong, I don't even know what they're doing. They don't even know what they're doing yet. And the state doesn't even know what they're doing yet, because they haven't even figured out the capacity issue of these training hubs.
Yeah.
Well, and I also think that, to building on what Rebecca said is, we are also looking at having the workforce standards, and that includes Board of Health members, by the way. And so maybe some of the things that we can do is help facilitate like a local presentation of, like, for instance, the emergency management that's required, the ICS 100, and do sort things like that to make sure that we're building up capacity. Those trainings already exist, but maybe having a communal spot or opportunity for us to take part of them locally might really help, and ultimately will help our shared service agreement comply with those workforce standards early on. That would be great to be able to demonstrate that.
Right, Jane, the disaster preparedness, I know there are a number of towns in Massachusetts that are now rewriting their programs for disaster response, preparedness and response. So a session on the role of the Board of Health in that context, since we're a piece of it and have to write some policy and procedure stuff for them, which frankly I'm sort of clueless on.
Yeah,
would be great.
Yeah, and also, Pat, on emergency preparedness, Berkshire Regional gets significant funding to provide that technical assistance for all the boards of health.
Right,
They've been getting
right.
that funding for years, and like there's a role for the Board of Health. They have they're supposed to have a planner that facilitates all those conversations. Then, the Board of Health plays an input in that, getting contact information. But again, the emergency preparedness stuff has been going on for a long time.
Right.
But
And they do have BRPC does have a planner. Matthew Bryan, I think his name is, who is doing that.
Yeah.
So yeah, one way or the other, it's something that needs to be dealt with.
Yeah.
Great. Okay, anything else? If not, we'll move on to member up. Oh, Rebecca, did you have something? No, I thought I saw a hand go by. Okay. Member updates. Is there anyone who has something they wish to share? Brandy?
Otis just would like to share, we renovated an office, so we have a nurse's space now. We're going to use it for foot checks, any vaccines, mental health visits. So we're excited to get that up and running. It'll really support our COA as well.
Great, thank you. Anyone else? All right, I can report that Sheffield now has a part-time administrative aide. I'm not sure what the title is. Somebody working with several boards, and I'm hopeful that will work out. Anything? All right, do we have no citizens left, do we? After Mike left. All right. Next meeting will be in December, or are we going to jump to January?
I mean, I guess we could leave it open. I mean, I think with the holiday break, people are taking vacations. I don't anticipate anything crazy coming up in the next 4 weeks. We may just cancel December and go to January, but it's really up to everybody. I don't think there's a lot of work to be done in December other than posting the position and
what would the date of that meeting be if it were in December?
Second.
The 8th.
December 8th?
Yeah.
That seems really quick for some reason.
Yeah, which is only 3 weeks away. So I don't see a lot of activity, and be mindful of people's time during the holiday break.
So put it on your calendar, but don't get excited if it gets canceled. Or get excited if it gets canceled. The January meeting would then be
The 8th.
the 8th of January.
No, wait a
Okay.
minute. No, wait a minute. 12th.
12. Okay, so calendar them both. And let's see what happens. Any questions or comments as we close out? Thank
No,
you.
my only comment, I said at the beginning, I really want to thank Pat and Rebecca for serving as inaugural chair and vice since the inception, and we all did a lot of work, and I appreciate you taking that on as a new board. So we really appreciate it.
Well, thank you for your guidance. That was critical to the success, and I think it has been a significant success on the part of the collaborative, getting up and running, getting everything together as we have, nobody losing their mind as we go through it all. Okay, we have meetings set. We would need a motion to adjourn.
I'll make the motion to adjourn.
I'll second it. I'm assuming we can just leave. We need a roll call.
Yay. Everyone just say yay.
Yes.
Great. Happy holidays, everybody.
Thank you.
Thanks, everyone.